So what about what's different then for people on the spectrum? So actually, there's been some research looking about how people learn about sex and relationships. That's why I asked you at the beginning how you learnt about it. So actually they've shown that parents provide less sex ed to children with autism compared to those without. So they're less likely to sit down and have that conversation and to talk to them and to tell them about it. I do, usually sort of once a year or once every other year, I do a course for some of the special schools in this area over 3 evenings, usually with parents and with teachers. And it's interesting how parents will often say they've found it difficult to sit down, or they haven't sat down and tried to have conversations with their child or their teenager on the spectrum about autism. It's this feeling of I don't know where to start, or how would I say it, or I'm not sure what they need to know. So parents provided less sex ed to children with ASC according to their IQ levels. So this is implying that those who have a learning disability or are less able are even less likely to have any kind of information or talks with their parents around sexuality and relationships. Interesting, adults with autism, 2 times less likely to get knowledge from their peers. So that comment about your friends at school, if you think about it, they're less likely to have friends at school to have those conversations with, less likely to get information from teachers, as well as less likely to have had information from their parents. And they're 4 times more likely to get any knowledge they have around sexuality from the TV, from the internet, and from non-social media, so Googling, so looking stuff up online. As you can see, there are inherent problems in that. What might be inherent problems in TV, in internet, and that kind of thing. Certainly as a psychologist, I've had many referrals over the years, for people who have watched things online, they've watched hardcore porn online, and then they're acting it out, or they're copying what they've seen when they're back into day services, or they're back at college or something like that. So far more issues with expectations. I have clients who are very able indeed, who watch hardcore porn and are convinced that's what everybody else is doing every weekend, that we're all out there doing that that's what they've seen on the screen, so that's how it must be. It's literal interpretation of what's being seen. No amount of me saying, no, I'm not having orgies every weekend, that's not what I'm doing, convinces, because that's what, and trying to say, but that's not real, and I get it, and they'll say, but that is real, that's people on there doing that. Yeah, no, actually that's right, that is people on there doing that, but they're being paid and filmed to do that. That's not what everyone's doing when they finish work on a Friday night and go home. Or maybe it is. So what else is different? Well, actually, physical development might be different. It might be a delay. I've come across people, or young people, with very precocious development. One lady, a foster mum, who was caring for a young lad of 9 who was already fully developed sexually and was trying to have sex with somebody at that age already. Others, it may be a much more delayed physical development, if you like. It might be that there are specific sensory issues for people, like touch or sensations around smell, any of those things that if you're getting in close to another person, or if you're just going on a date with another person and they're wearing strong perfume, that might be enough to really put somebody off and to find it extremely difficult. It's quite hard to get into a sexual relationship with somebody without having to get skin to skin at some point and having to feel those feelings and sensations. Again, if that's something you really can't stand or you find difficult, you've got another whole level of difficulties there. And things like epilepsy, there's some evidence, I think a study a long time ago, Michael Rutter, showed that about 10% of the people he worked with, the children he worked with, their mental health declined significantly during puberty. Anxiety increased, depression increased for people, or appeared for people. A high rate of people develop epilepsy. They still don't know what the link is between autism and epilepsy, but either the 2 peaks are either in very early childhood or in puberty, that adolescents might then start to develop epilepsy. Cognitive development, so awareness of yourself, I touched on earlier, as an individual, as a different person, as someone separate from mum. That happens very small with babies without autism. For some people on the spectrum, that doesn't develop in the same way. Some people don't have that sense of a self being separate from others. And again, that makes it really hard then to relate to another person. If you're not sure, actually where do I end and they start, what's about me, what's about them. And the brain's a very important part of sex and of orgasm. So there's studies have shown that actually it's something like 80% of people fantasize whilst they're having sex. So if you don't have that imaginative skill, you're missing out on a whole area, if you like. And you may not even be aware that that's happening, but it means that what you're thinking about, how you're interacting, is going to be affected if you don't have that ability to fantasize. So the concrete thinking part, if you think about a lot of the language that we use in this area, we don't tend to use textbook phrases. We don't tend to go up to somebody in a pub and say, I'd like to have sexual intercourse with you, because it's a little formal, it's a little off-putting. We tend to use slang, and we use inferences. Sometimes we don't even say anything. We might just look at someone and... But I'm not doing anything from my neck down. All I'm doing is from my face upwards, and I'm only using very few muscles in my face. And you're giggling, you're laughing, because you know, and I made Becca blush, because you know what I'm meaning. And if you don't get body language, if you don't pick up on body language, then that's another whole area. A, that you're missing out on, you're not likely to pick up those signals, but you're not also able to give those signals to other people, because for most of us, it's a very subtle process to start with. We may not even be aware that we're responding that way to somebody else. It's so subtle. But if you don't get that, then there's a big opportunity there for missed communication, if you like, and misinterpretation. So this lack of abstract thought, and actually the language, let me just go back to that as well, because, interesting, this is a while back, I was doing workshops with a local charity for young people on the spectrum over 3 weekends, and I was asked to do the job of the class that did the nitty-gritty, what goes where, what do you do with all of it. And I thought, actually, I'm going to start way back before that, because there's evidence to show that with young people on the spectrum, you need to start at a much more simple beginning, if you like. So I thought, I'm just going to do the language. I'm just going to put together a chart of all the slang words and different words people use for different aspects of relationships and sexuality. So the first bit on it was sexual intercourse, and you'll have to forgive my French here, because my language, because the first word in all the slang, of course, is fuck. And I could hear all these young men outside using the word, bandying it about, without fail. Every one of the 3 groups, they went, that's what it means, So they're hearing words and they're using words, but they don't necessarily know what those words mean. And again, it leaves you vulnerable to getting into a difficult situation if you've not understood what's being said to you, or if you're using language without realising what you said to somebody. I worked a long time ago with a gentleman who, his interest at the time was spells and magic, and he'd had a book of spells, and he wanted to... I can't remember what it needed for this particular spell, but part of what you needed was to be intimate with a woman, was what it said. So he knew one lady in the complex where he lived, so he went and rang on her doorbell and asked if he could be intimate with her. And of course, he had no concept of what he'd asked. What I got was the phone call from the manager going, he's propositioning the lady down the corridor, can you come? And the first thing I asked him, what does that mean? He didn't know. He just read it in the book and was mortified when I explained that means you'd like to go and have sex with somebody. But we assume that people will know that, or they'll pick up those kind of intimations, and they don't necessarily. So this lack of abstract thought means that you might only learn by doing it, by experiencing it, by seeing it, by hearing it. This is where the internet porn comes in, if you like, because if that's what you're watching and you're assuming that that's what everybody else does, then there's a risk there that that's what you're going to think happens if you do meet a partner. So you need to be quite careful, or we need to be quite careful, therefore, what somebody sees. You can't just explain it and let them put the pieces together and work it out, as we often do, and come to the conclusion, because they might come to quite a different conclusion. So the person may not be able to understand something that they can't actually experience or see. And I've already mentioned, it might be that people act out those ideas in an attempt to make them concrete, to experience them, without realising that actually this isn't the place to do that. So people talk about theory of mind skills in autism. It's not specifically just an issue with people on the autistic spectrum. It's also for people with frontal lobe injuries and things like that, and not everyone on the spectrum has theory of mind difficulties. However, for people who do, this ability to put yourself into the head, into the mind of somebody else, and understand that what they're thinking is not necessarily what you're thinking. What they believe is not necessarily what you believe.
I suppose there's also a risk that people would try and educate themselves via the internet or porn and
Absolutely.
Have a warped idea.
Yeah, absolutely. So I have clients whose idea of what everybody else is doing out there is taken directly from hardcore porn.
I wonder, you can understand as a parent why that would be a difficult for any of us to talk to our kids about sex. It feels like the schools and the system should be encouraging that kind of education.
I think schools in general do. They have to provide that education, but it's providing it in a format that people can take on board and they can understand. Even special schools, you know, the way it's presented there is not always concrete enough or explicit enough for somebody on the spectrum. So you need to be, and quite often you need to start right back at a much earlier level for them. You can't kind of make any assumptions around it.
Do you think there's an element of parents not wanting to talk about sex? Maybe they see adults as younger developmentally because they require support and therefore struggling to sort of transition to seeing their children as young adults?
Yeah, I mean, I wouldn't make a blanket, yes, it's people don't want to talk about it. I think any parent, it's an individual thing, isn't it? Any parent, it might not be their top choice of what they want to sit and talk to their kids about. Some parents are brilliant and have no issue with it and are able to have really open discussions. Some kids, children or adolescents or young people or even older people, adults, don't want their parents to talk to them about it, so we'll close the conversation down. I mean, that's no different to anyone without autism, if you like. So it's whether they can have those conversations. Some parents have said to me after courses, well, I didn't feel confident to talk to them about it, but now I do. So sometimes it's just a confidence issue. And some parents feel it's not their role, and they feel that that's what school should be doing, that they should be educating in that. It's different for everybody, but what the research shows is that fewer parents feel able to talk about sex to their young people with autism for all sorts of reasons.
Sure.
You know, if you think communication, it's a delicate area of communication, and if communication is something that's difficult, it's probably not the most easy subject to broach.
It makes it very hard to understand somebody else's viewpoint, someone else's wishes or desires, if you like. And you need the right vocabulary to be able to communicate about what you would like to do in a sensitive way to somebody without offending them. A long time ago, this is a case of a couple where the young man was on the autistic spectrum, the young lady had Down syndrome, but they had been in a relationship for quite a while, and they had been referred through to psychology because the young lady was saying that she was being raped and she wanted to end the relationship. After work with both parties and bringing them together, what it turned out was that he was not understanding that she didn't necessarily want to have sex whenever he did. And his assumption was because it was in his mind, because he wanted to do it, then she would want to. So really, really simple. I always quote this one, really simple approach. A yes card and a no card under each of their pillows. And every evening they were told to come up and put a yes or a no on the pillow. And there was a laminated sign put on the back of the bedroom door. Yes plus yes equals yes. Yes plus no equals no. No plus no equals no. Very simple and very straightforward. Personally, I think it's a brilliant idea. You think, no more having to say, oh, I've got a headache or I'm too tired. Just have it there. And I mentioned this at some training years ago. One of the assistants there came up to me afterwards and she said, you do know that they're selling them, I think it's, where is it? I can't remember the name of the shop in Oxford that was actually selling pillowcases. I have them, I should have brought them, I have them at home. And on one side it's got printed yes in red with little hearts. On the other side it's got printed no in black with little club signs around it. So there you go. Somebody else has thought of it for the rest of us. But if you can't say that yourself, if you lack the confidence to say that, or the understanding even, that you need to say that, or you need to ask the other person, you can see there's a minefield there of very difficult situations that people could end up in. There is therefore a much greater risk with people on the spectrum being abused, and also of unintentionally being abusers, because they haven't understood or they've misinterpreted. Social development, I've talked about. So I've mentioned before, actually, for most people on the spectrum, having those social skills to even start having a relationship is often really difficult. And actually then your understanding of that relationship. You'll become, a lot of people say they feel like they're observers standing on the edge of any social event or of any scene or of life. A couple of guys recently both saying to me, I feel like an observer on the sidelines, watching everybody else have their lives, watching everybody else do all the things I want to do, have a job, have a partner, have a family. And it's like a glass wall trying to get in there and trying to make that happen for myself. So the emotional development side. So what's different about that? Well, I've already said, it's a time of strong emotion and sexual impulses for everybody, and that challenge of learning to control them. So often, for children and adults on the spectrum, learning to control emotions is a major, major issue. So the meltdowns that people will have as children, that people have as adults, a lot of clients I work with still have meltdowns. It's that overwhelming feeling of having an emotion, but not knowing what it is, not being able to name that emotion or even tell you what that particularly feels like. They're just out of control. And if you think about it, if you can't even name it, you can't even begin to recognise that it's inside you, and then therefore you can't even begin to think about how you might control that, or what you might do to help that. Donna Williams, who's, people are familiar with her, a lady who sadly passed away last year on the autistic spectrum. She was the first person to write an autobiography of what it was like back in the 90s, I think, of being on the autistic spectrum. She talked about, she used to think that anger was something in a bucket in the corner of a room. And periodically, this bucket would get thrown over her and she would get drenched in this, what she assumed was a feeling, this thing. She'd feel completely out of control and she just had to wait for it all to drip off her and to go away. So if you think about what she's saying, she doesn't even, or didn't even comprehend it was an internal thing going on. It was something from outside that somebody randomly threw on her and she just had to wait for it to go. So the idea that you can then start to do things that would help that becomes quite separate, quite alien. So the beginnings are often actually helping people just even to recognise that this is something that's going on inside of you, and then start to recognise maybe what it's called or how you might describe it or where it is in your body. This is going on generally for kids through puberty, this ability to start recognising the emotions and naming them, but often it's not happening for people on the spectrum. So whilst everybody else is becoming more controlled, they are still in the same situation of struggling to control feelings or even to recognise feelings. I have a lady I worked with for quite a while who said to me a couple of months back, I suppose, that she'd had this funny feeling, and she's great. She started to be able to work out what those feelings are now, and she turned around and she said, do you know, it was happy. For the first time, I worked out that I was happy, to only just start to be able to realise that that's what the feeling is.
Are there any positives that you can see in the autistic spectrum disorder area or situation which actually help in terms of sexuality and relationships?
Well, a lot of people respond very well to rules. And so in some ways, it's difficult, isn't it? I can think of an answer that's both for and against that. I was going to say, in some ways, if you have someone who's very rule-driven and you can give very clear rules, it's not okay to do this, it's okay to do this. Sometimes that's much simpler, and actually life is much simpler, and the response is much simpler. But then this is such a grey area. Sexuality and relationships, there are so many subtleties in it that sometimes actually, as I'm saying it, I'm thinking, no, that's not necessarily always a good thing, because then sometimes people get tripped up by a rule applying in this situation, and then they apply it in another situation, and it doesn't help there. I thought you were going to ask, I'm painfully aware that a lot of this is negative, and it feels very difficult and unfair. I can only counter by saying, as a psychologist and as a sports staff, a lot of what we deal with are trying to help people and keep them safe and help them actually have these opportunities and have relationships. I went to a wedding year before last by somebody we support on the autistic spectrum, which was wonderful. I've known him for a long time. He's had a difficult life. But he got married to a lovely young lady, this gentleman with a mild learning disability and on the autistic spectrum, and they are very, very happy. So this doesn't mean, none of this means that people don't or can't have relationships, they do. And I know several people who are on the spectrum and married and very happy. It's just, I think, much harder for people to get there. I haven't really answered your question.
I think it's quite a difficult question, but often in employment areas and things like that, there are more obvious benefits that the, say, Asperger's or something like that, can apply to jobs in coding, computers, etc., etc.
I guess, to be honest, I guess it's like any relationship. If you find a match, so if you have someone on the spectrum who, say, has particular characteristics, and they can meet a partner who balances those characteristics, then yes, there's no reason why that's not going to work as well as any relationship where you have two partners who are well matched. From my experience, the relationships that work best tend to be both people being on the spectrum, or often it's the man on the spectrum, that's sexist of me, it could be the other way around, and the partner is somebody in the caring services, so somebody who is very good at noticing and adapting themselves and making space, if you like, for somebody's particular way of being and seeing the world. So somebody who understands that and compensates for it, essentially. That tends to be the most successful partnerships that I've seen.
Or someone who doesn't speak English as their first language, and some of the subtleties are taken out. Do you think honesty, though, is the strength of someone on the spectrum often in terms of what makes them good at relationships? If they find someone who gets them, they tend to be very honest.
They tend to be extremely honest, which isn't always easy to take.
But it can work.
Yeah. Yes, it is a strength, yes, because you'll always know exactly where you stand with that person. You might not like where you're standing, but you'll know that's where you're standing.
There are the positive sides to it as well. And I'm just wondering if you could just mention some of the positive aspects of Asperger's that condition might bring to a relationship.
Sure, I'd say probably the biggest one is loyalty. That actually people on the spectrum, if you make a friendship, a relationship with them, tend to be very loyal. You know,
and do you think they would be more intense potentially as well?
Well, it could be either way. Yeah. So they could be more intense, or they could be somebody who's slightly more distant. So the longer I work with autism, the more I think of it as a condition of extremes, that often there's not much grey in the middle. So you might have people who really need to keep their distance, to be quite contained within a relationship, who can't manage too much coming from the other person. You might have other people who are very intense, very attached. It could be either, how it affects people. But I would say that there is a tendency for people to be very loyal and very supportive of their partner to the extent they're able to be.